Great, welcome back, Ollie. It's nice to be back together again. I
Yeah,
don't
it's
know
good.
yeah, I don't know what episode we're on right now, so I'm going to leave that. But actually, we've done quite a few of them now, which has been really, really good. But I know there's been something on your mind. You've been
Yeah.
thinking, and you've shared something with me earlier, which I'm going to call Hart's hierarchy, which I know you don't particularly like, but I think is a
Oh, you
really
know I love it, Tim. You know I'm no shrinking violet. You know
I
that.
think it's a really, really good idea, which again, I think, absolutely represents what we're about at Peak Health and what we try and teach in terms of our health coaching. So, yeah, do you want to just share with everyone? Because I think it will be quite good to hear a bit more about that.
Yeah, thanks, Tim. You indulge me, don't you? So hot on the tails of Maslow's hierarchy and Lencioni's hierarchy of dysfunctions of teams. What we thought we'd do is think about the sort of stages and sort of like levels of progression, I guess, that a health coach might take someone through. And it helps you to remind you of what you must do first before you move to the next level, if you like, really. So I'll share a slide. Here we go. Let's just get this up here. So, Maslow has 5 levels, Lencioni has 5 levels. I tried to just keep it really simple, keep it to three. But I think it describes how we progress. So the base level is people's self-belief. And basically, if they don't have self-belief, you can't really coach them. And I think that's where a lot of the basic health coaching work is. And effectively, what you've got to do is decide, are they in the game? Are you in the game as a coach because they're working with you? And is the patient in the game with you? So do they believe in themselves? Do they believe they have capability and capacity to be able to make any changes? Do they believe it's worth it? Do they believe they're worth it? And so much of the basic health coaching skills is helping to kind of like build this foundation. And we can talk about how we do that in our training, if you like, really. The next level, though, once you've got that self-belief and you start to then bring in some actual sort of like techniques and structure, I think there's two core pillars. So increasingly, we see people addressing those kind of lifestyle, the sort of the lifestyle pillars, don't they? So your diet, your exercise, how you move, how you manage stress, how you deal with the sort of like overly triggered sympathetic immune, nervous system. So those core lifestyle pillars, and then the sort of social pillars as well. So the sort of wider terms of health, your social setting, and we could talk a bit more about that. It's your workplace, it's your housing, it's your security and your finances, and so on. And I think what health coaches do is they sort of almost start there and make sure that you address any sort of major issues there. And then on top of that, you've then got condition specific things that we're doing with people. And Tim, you and I know, don't you, that like when it comes to sort of, like the big areas we deal with, chronic pain, metabolic dysfunction, mental health, there are sort of relevant coaching techniques you can focus on. So, dietary support might be quite different in the context of insulin resistance, for instance, or with a, sensitized nervous system where you've got neuroplastic pain. You might be thinking quite differently about how you manage stress and some of the techniques like sort of some of the somatic tracking or some of the visualization or breathing exercises you would use in that condition. So that's my proposal. Anyway, I'll leave it on the table there and see what you think. Let me stop sharing and let's go back and have a chat about it.
Yeah, well, first of all, I love the fact how you've lined it up alongside Maslow and Lencioni. I'm sure it should be on the same platform as those things, and you've
Well,
made and
clearly,
clearly, and you've
clearly
made
in
it.
decades to come, they'll be saying, "Oh yes, there's Hart's hierarchy of health coaching." Yeah.
I'm sure. I'm sure, but it really is helpful. I suppose because I'm quite visual, it's so helpful to kind of have that just represented in that way. And of course, we work in the NHS, so triangles abound. We love a triangle, don't we, in the NHS?
It's either triangles or circles, isn't it? Or sort of like quite. Sometimes you have quadrangles, don't you? That's really sophisticated,
Yeah.
isn't it?
That's advanced. That's advanced. Let's stick to triangles. Okay. And I suppose for me, and again, what kind of comes up in supervision often is people think the coaching is all about that top bit.
Mm.
And then sometimes coaches sometimes feel like, well, actually, someone's not ready for, goal setting, not ready to work on their management of their long-term condition. And therefore, in some ways, they maybe just need to come back when they're a bit more ready. But I love that we absolutely need to start with where they are and also really make sure that we've got those kind of that baseline covered off before we do any of the other parts, or at least alongside it. I don't know. What do you
Yeah,
think?
yeah. No, I think that's core, isn't it? And I mean, it's not to say that you have to always stick like this. I mean, sometimes you might gain someone's confidence, mightn't you? We know that as a GP, we might prescribe something or try and get a foot in the door so that we know we've done something immediately, that gets their trust and means they'll work with us. You might take them through a very basic breathing exercise so they've got something to work on, something tangible. But I think generally, unless you know the person is in the right mindset and feels kind of positive about what they're going to do, feels optimistic, and actually sort of is prepared to take a little bit of a risk, because coaching is all about trying to shift someone from where they are that's not working so well to somewhere that's going to be a lot more aligned to what matters to them and help them achieve what they want. So there's going to be some work to be done. So unless you've built up their, you talk about it as rocket fuel, Tim, don't you? You know, the rocket fuel to get someone off the ground. Actually, a lot of the coaching tools and techniques are about building the person up first before you start to address their issues, isn't it?
Yeah, and that can take time. I suppose that's my experience. It can take time because we need to build trust in that relationship in order that people then share what's really going on for them or what really matters. So without doing that, I think it is very difficult to move on. I think we can, and we can sometimes, successfully, seemingly coach people on behavioral things and some of those things that are kind of a bit more surface. But my experience is that if we don't dig down to some degree into kind of someone's kind of self-beliefs and their beliefs about their capability to do the work and maintain that for themselves, then as soon as we stop working with them, then it's quite easy for them to kind of tail off. I don't know. What's your experience?
Completely. And I think it's so important, and it's not just you and me plucking this out of the air, is it? It is very theory based. I love Ryan and Decky's self-determination theory. So they've been around for decades, since the 1950s and 60s, haven't they? With developing their research and developing their evidence base, and they've really clearly shown that if you do want people to make effective, sustainable behavior change, their people's autonomy and sense of control is really important. Such a key thing. So you're building them up so that they can be in control and lead things. A lot of theory behind that. The other theory that I really like, and there are lots of others. The other one I really like is Aaron Antonovsky's salutogenesis work, and he talks about something called sense of coherence being so important. So it's really that really means, does your life story make sense to you? What you're, how you think of yourself and what you're doing. Do you feel a sense of sort of meaning and purpose? And again, I think that's a lot of that base layer of self-belief that, do you believe that what you're doing has value and meaning? And if you don't, you're just you're if we think of this kind of hierarchy as like building a house and the foundation, if you don't spend time on the foundations, it doesn't matter how good the house is you build above it, if it's on poor foundations, at some point it's going to sink and crumble and just dissolve. So it's really worth getting those foundations right.
Yeah. So how do you think we do that then, or how should coaches be working with people in a way that builds that? Because it is key, isn't it?
Yeah, well, it's not always easy, is it? And I think one of the things I certainly we believe in, don't we, is this concept of activation in healthcare, but some way, I guess, of assessing how capable and sort of confident you think someone is already, really. So what are their current skills, knowledge, and confidence to look after themselves, take a lead? I think some people are already clearly doing loads of stuff already. They're really very competent, and you don't need to spend very long at all. You can get on with the rest of it, if you like. But for some people, you can tell, they're absolutely overwhelmed with life, often for very good reason. There are other priorities, other things taking their attention, their energy. So if you're gonna get them to work on things themselves, you have to help them to carve out some space. So it, as always, starts with the person. You tailor it to where they're at, and you spend time exploring it, don't you? You explore what's going on, what matters to them, and you start from there. How about you? How do you do it? How do you build that foundation?
Yeah, well, I think it absolutely comes from that spending the time and building the trust. I think that's where it comes from. But also maybe asking asking some of those questions in terms of, what people kind of feel about themselves. Do they value themselves? Or are they always putting other people first? Is that their kind of MO? That's what they tend to do.
Yeah.
Or do they sometimes, or do they think actually it's important and it's relevant to kind of prioritize something for themselves as well? So I think that's where I come at it from, I think.
Yeah. I hear you
Yeah.
say that. It's that sort of sense of self-worth, is it? That I am worth it and it is worth it. But I also think there's something about getting on the table what people's strengths are and what their assets are. I think so often people focus on what they can't do. And, I've got ADHD, which means I can't do this and I need special support like that, which I absolutely get. But very often, I think they overlook the strengths they have. So I often find that people that live with ADHD, as I've just picked that out, they're extremely focused when they're doing something they really want to do. And they're often really compassionate and are able to see the kind of like the right and wrong of the situation. So actually, if you get them focused in on something that matters to them and that they have sort of an expertise in, and you can show them that they can fly and go make so much better progress than someone that perhaps hasn't got a brain that works that way.
Yeah. I also wanted to just pick up, Ollie, on your thoughts about kind of as a coach, are you in the game? Because I think, I mean, that's actually it's come up in supervision as well. So sometimes coaches feeling like they're a fraud or they're not good enough to
Mm.
do it. So do they have enough kind of self-belief about what they're doing? And I think some of that comes from the feeling like I don't know enough.
Mm.
I need to be able to kind of impart some sort of wisdom because we're so used to feeling like the important thing is what we give people so they can go away and we take it away and do something rather than what we draw out of them, which I think
Yeah,
agree
yeah.
is probably more important. What do
I
you think?
know. Well, it's something we talk about, isn't it? And it's so it's actually one of the real superpowers of coaching, isn't it? Is when you realize it isn't all about you and that you don't have to be the one that finds all the answers. But that's quite difficult, isn't it? If you've been a professional, you're used to being the person that's got all the solutions and the answers. You often have this expectation of yourself, don't you, that you should lead things and you should be clever and you should come up with the good ideas. And if you're not doing that, you're not really doing your job properly. So I think health coaching, as I know you know, it's a very different set of skills, isn't it? It's having the degree of confidence to step back and say, it's not all about me. I'm going to give you space to come up with your own ideas and to build your own confidence. So a lot of it doesn't, you don't have to do a great deal, but you have to have enough confidence to step back. And that's what I guess what we teach people, isn't it? Is to have confidence and to know the techniques to be able to do that, the sort of questions to ask that then encourages people. So one of my favorites is at an early stage here is, just tell me a little bit about what you're already doing to look after yourself. It doesn't require any input from me. It just requires me to be curious and interested and then delve deeper and explore a bit more. Yo, tell me a bit more about that. Yeah, go a bit deeper there. How does that work then? And how does that make you feel? And what's working and what's not? So you're learning the techniques of a coach to explore, but you're not actually having to have any of the answers yourself. So it's actually really liberating in a lot of ways, isn't it? Have you, I mean, I know you work like that as well, Tim. Have you got anything to add to that?
Yeah, well, again, I think we've kind of maybe used this phrase before, but it's that kind of don't let your knowing get in the way of someone else's discovery. And actually, if we knew that was important, it was more important to provide a space where people could work it out for themselves and find things out for themselves, then we could maybe just be a little bit more easeful and be able to do that, stepping back, like you say, rather than think like we've got to have all the answers. Um, and actually, I've had a coach say to me, actually, when they do find themselves slipping into kind of giving advice or giving people tips to think, actually, it felt really hollow. It felt like this
Yeah,
isn't really what I'm here to do.
yeah,
But sometimes we just slip into that because we feel like we need to do it for people.
yeah,
But actually, the thing that gives us all a buzz, I think, is when people are able to do that thinking for themselves. And
yeah.
that's the most sustainable thing, isn't it? When people can start doing that thinking for themselves because we've created that right environment for them to do it, I think.
Completely. And what I reflect on this sort of hierarchy is that actually, if all you do is build that base layer, that's an incredibly powerful thing to do. It's often not done, and people will build their own house on top of the foundation you've helped them to build. And isn't that wonderful? Because it's their house, then not yours. So, a lot of I would say our first 4 days of training, our sort of like core training, which is what we set NHS health coaches up with. It's all about how to do that base layer, isn't it? And, in a way, you sometimes sort of find that having too much knowledge and information about the health stuff can almost get in the way because you're very tempted to give solutions and tips. So good health coaches learn that base layer and then they only build stuff on top when they feel they really need it, and then in a way that again keeps that person in control and keeps them leading.
Yeah, yeah. I was just reflecting. I've seen something on LinkedIn today. In fact, I'd done that video about ideas and icebergs. You know, where you kind of have the
Oh,
tip of the
yes.
iceberg, which is
With
the
the
kind of
red whale,
bit.
with the red whale obesity program. Yeah, that was
Exactly. So I've done that, and then Nikki Doherty had kind of commented, and I think it was so insightful. And what she said was actually in the health service, what we have are multiple tips of the iceberg, but it's the same iceberg that's sitting below the surface. But there's these multiple bits that are sticking out, which are maybe there's a bit of respiratory, there's a bit of chronic pain, a bit of metabolic health. The stuff that sticks out that people end up then spending all their energy trying to manage these tips of the iceberg rather than going below the surface and saying, well, actually, do you know what? There's a whole load of common things here which are kind of causing these different bits that we can see. Does that make sense?
completely. Yeah, and it makes me, as you're talking about it, it makes me think actually this base layer we're talking about, there's so much to it, isn't there? Do you know what I mean? There are so many skills and techniques. Yeah,
And the coaches, I suppose, their bread and butter is probably helping people to think about those pillars of health, and the stress and the movement and the diet and all of those things.
yeah,
But actually, there is a bit that sits below that. That's not enough. It's the bit below that which is also important. If you want people to kind of
yeah.
think that they're worth feeding well and they're worth moving well, then we maybe need to deal with that a little bit as well.
Yes, exactly. And I think my thinking here has been informed by a conversation with who's a public health doctor in Wales, and um, yeah, he just a penny drop for me. He just sort of said, we talk about wider determinants of health, like the social things and the kind of like the pillars, lifestyle pillars, but there's a whole lot of determinants that are much more important upstream, and they're just how you feel about yourself. But so it is this sort of base layer. So thank you for that. He's definitely sort of informed that thinking. But so that middle layer then. So, you do once you've got someone believing well in themselves, I guess the basics that work for nearly everybody, isn't it? Is are you addressing those foundations of health, sort of that you can do to look after yourself? Are you, thinking well, managing your stress? Are you eating a good diet that's suitable for you? Are you moving well, keeping kind of movement in your life? And what's the other one? Gosh, I'm
Managing stress, that might be one.
Yeah, eating well, moving well, managing stress, and sleeping well. Sleep is
Yes.
always a classic, isn't it? And then I think there's the whole thing about the toxins that are coming in or around you, isn't there? So those kind of real core pillars of lifestyle, and then not forgetting the key pillars of your social setting as well. And I think that's what, again, generically health coaches come to. They don't have to have a lot of knowledge. They just help people explore that, work out which areas are working well and which areas are perhaps risk factors for them, if you like, really risk factors preventing them from having good health and living well, and they just draw their attention to it, don't they? Such that okay, what do you think you could do about these?
Yeah. So you don't actually need to know a lot in order to kind of be a health coach. Do you know what I mean? And like you said, it could get in the way. It doesn't mean that we want to keep ourselves ignorant of things and what the kind of the trends are and things. I think that's important. Um, but let's make the most important thing be creating a space where people can think about that for themselves. And again, we can layer on those kind of condition specific things, in additional training if people want to get a bit more comfortable, being able to kind of explain chronic pain will be a really good one, wouldn't it? And explain what's going on in the body in terms of in diabetes, that would be really good. And also
Yeah.
in mental health. So we can layer those things on, but they are seeming for me anyway, they are less important than the core skills of building up people's self-belief and those pillars.
Well, it's an interesting debate, isn't it? Because I remember when we were starting, we always used to say, didn't we, actually, that too much knowledge for a health coach to start off with, it gets in the way. But I do think that if you are going to be a really rounded health coach and you're going to support someone, you need a bit of insight on these areas, don't you? So, but you need to be skilled enough to know that the insight helps you to help people to navigate, to be a supporting partner rather than being the director and the one that's telling them what to do. So I think people do in the end need to understand, if someone has insulin resistance because they've got, metabolic disease, what that means, and what sort of dietary options are going to be useful for them, and what sort of things, people need to know the basics, don't they? That, like, if you're insulin resistant, then too much sugar in your diet is not going to be a good thing. You don't need to be a diabetes expert, and we're not expecting them to be sort of like a doctor level or maybe even a nurse level, but I think a health coach needs a basic level. So I think there's some core knowledge they need. And then if they're going to go on up to the top, then I think we can see, and I'm seeing this now with, for instance, the health coaches working with Pure Physiotherapy, Pure Unity, where they're starting to provide dedicated pain management health coaches and to some degree dedicated metabolic health coaches, where there's a little bit more depth of knowledge, and they are using those specific techniques for when someone wants to know, okay, well, if I'm not going to use pain medication, then I am going to self-manage this. What can I do? What are the options on the table? And then I think having some of those tools in your toolbox as a health coach, a whole range of them, and knowing what backup resources are out there. So, you don't have to have it all in your head, but you can say, well, that website might be good for you, or that book might be good in this situation, or actually, because you like that sort of thing, that podcast might be a good one for you to listen to. So they're able to skillfully guide people around all the resources that are available and support them in the way that's right for the person.
Yeah, I agree. And there's lots of resources, aren't there? And actually being kind of comfortable and confident with a number of those that you can then share with people at the right time,
Yeah.
in the right way. I mean, I think that's the other thing, isn't it? I think sometimes when we know a lot, we can be really quite keen to download what we know and think, well, that's the most useful thing. But Nancy Klein says about that component of information is it absorbing all the relevant facts, right? Not being told all the relevant facts, but absorbing all the relevant facts. So I think coaches are really skilled at picking up how much can this person at this particular time absorb right now. Because
I like that.
if they just gotta go, well, here's everything I know about diabetes, here's everything I know about pain management. You can there's this resource, this resource, this resource, this resource. People were already overwhelmed before they came,
Yeah,
and now they're
totally.
even more overwhelmed. So I think you're absolutely spot on. There is absolutely a place for that further information, and coaches, I think, are ideally placed to give that in the right way, in the right amount.
Yeah, no, you're dead right. So if you've got that foundation of it's the person that matters, their self-belief and their capability, you're always aware, aren't you, of am I overwhelming them? Is this actually inadvertently doing harm to them because I'm oversaturating them? I love that phrase. They just, what can they absorb? Well, they're full. They're absolutely full at the moment. Their brain is buzzing, they've got a lot to think on. That means no more information, maybe just more enabling and more confidence building, and starting to sort of get them to think about how they're going to put the information they've got into action. I love that question, so it's almost like pausing, isn't it? Going, so okay, so knowing what you know now, then what you've gleaned over the last few sessions or the last few minutes or whatever, what are you going to do next, and where do you think you go from here? And I think that always checking back to that as a coach and bearing in mind it's their self-belief, it's how they feel about themselves that matters most. You always come back to that.
Yeah, yeah, exactly, exactly. It's always going to be kind of led by them, isn't it? It's kind of like, okay, so bearing in mind, what you already know, what else might be useful for you to find out? It's that kind of question rather than just again everything, everything more that I know that might be filling in the gaps.
Yeah.
Um, yeah, because we don't want to overwhelm people. We absolutely do want to do that.
No.
Um, yeah, yeah, nice one.
Cool.
So,
Well, I'd be very interested to hear what people think. It's kind of work in progress, this, isn't it? Maybe we have to subdivide that self-belief level. I'd be interested to see what people think of the components of that, if we can at all. I'd be interested to hear what people think about those two pillars of whether sort of the lifestyle pillars and the social pillars. Maybe rather than a hierarchy, it should be a house. Do you remember that year of the
your
year of
care.
care? They had that sort of house of care, didn't they, with the
Mm.
foundation, the two walls, and then the roof on top. Maybe that should be the model. But I think it can, for me, as we've stressed, this just emphasizes that it's that foundation that's so important, and that actually, that's what you learn as a health coach to start off with, and that is the most important thing.
Yeah. And I suppose if you've just been talking there, it is not this kind of there's this, then there's this, then there's this. When you're in a conversation, you'll be moving up and down this kind of hierarchy, won't you? I suspect
Yeah.
at different times in the conversation and at different times over the time that people spend with a client or a patient. So yeah, let's not confine people or restrict people. It's not meant to do that. It's just meant to give people a kind of a framework, I suppose, uh, to think into, I suppose, what for themselves as coaches, but also to support their work with the clients they're working with. Yeah.
Yeah, brilliant. Well, if you've watched this all the way to the end, please do put some comments in. It would be brilliant to do that. We know hundreds of you are watching these videos all the way through to the end. So just let yourself known to us, put a little comment at the bottom, maybe your thoughts. We know that the purpose of these sort of type of podcasts is to get you thinking, isn't it? What have been your reflections? Were there things you agreed with? Were there things that you didn't? Things that you think you're dying to say to us to enhance what we're thinking? That would be absolutely fantastic.
Or just that you made it to the end. I mean, just put that is fine.
I made it to the end. That'll be interesting, won't it? Nice and Tim. It's always good to chat. Do you think there's anything else we need to say about this at the moment?
No, I think we may revisit it. I think we'll come back to it, won't we? Because it's not finished. This is
Oh,
just a starting point, isn't it? I think.
exactly. Yeah, we might co-author. Could it be Hart and Williams's hierarchy of health coaching or the peak health coaching hierarchy of health coaching? Who knows?
I think the Hearts hierarchy is good. It's just a better alliteration, I think.
Oh, it does. Actually, it's got a sort of ring to it, hasn't it? It trips
All
off the
right.
tongue, eh? Nice one. Lovely to chat to you, Tim. Cheers.
Yeah, and you. See you.